Hello, Shant. First of all, let me say thank you for the opportunity to have this conversation.
Arman, hi. Thank you for having me. I'm very honored to be here and great to see you as always.
Great. Let's start with the simple question. Tell me about yourself a little bit.
Okay, so as with many Armenians, it may not be that simple. I myself was born and raised abroad in Los Angeles to parents that came from the Middle East in Iraq, and before that, the ancestry back to where your ancestry comes from in Western Armenia, in the Cilicia region in my example. So I was born and raised in Los Angeles. I have pursued a career in medicine. I am a surgeon by training, and I also have a background in public health.
Okay, interesting. So now we are sitting here in Armenia. So tell me, what bring you here?
Again, not a simple question to answer. It is probably the aggregation of many factors that have come into play in my life as someone who spent his youth seeing the independence of Armenia, seeing some of the hardships, and ultimately visiting and being able to be a part of Armenia. There has long been the existence of a drive, of a desire to be even more a part of Armenia, whether it's personally living here and being here with my family, as well as professionally, to be able to somehow contribute to the development of, in my case, the health sector or the improvement of the health sector. Of course, there's always been logistics at play and technicalities. One of the opportunities that I have been so fortunate to be able to take advantage of was the fact that I have worked at UCLA, and the newly established Promise Armenian Institute has a very strong mission to contribute to the development of Armenia, Armenian statehood. And it is because of this support of the Institute and through UCLA that I am now able to be here, reside here with my family, and be involved with various activities within healthcare.
Okay. And I know you moved to Armenia last year, yeah? Actually, it was less than 1 year after the war. Yes. And you came here with your family, with small kids. So, yeah, I assume it was probably a difficult decision for your family, yeah?
I would say probably one of the easiest decisions to make. I think that it has long been in the plans, having come to Armenia numerous times and seen both the advantages of being here in terms of quality of life and the values and the traditions and practices that we would be able to experience as a family, and particularly for the kids in our family, as well as the opportunity that I felt existed in terms of being able to professionally contribute, and not only to contribute, but to receive the experience and to develop myself further through that new experience. It was essentially a no-brainer.
But okay, let me ask you a challenging question. We all know what does it mean to be surgeon in the United States, yeah? I'm sure, you've been working for probably the most advanced hospitals in the world, yeah? So I don't honestly understand what exactly you can learn here, because you mentioned that coming here, it's also an opportunity for you to learn something and grow as a professional. So help me out to understand what you, being a surgeon in the US, working for the best hospital, what you can learn here.
I would say that Armenia has a unique set of challenges along with opportunities, of course, and being involved in the processes that allow for us to explore various solutions to these challenges would be an educational development and a life learning experience for anyone, regardless of their credentials or their abilities or skills, whether they be clinical or otherwise in the professional world abroad. And honestly, Arman, it's not so much unique to Armenia. I would say that equally in terms of challenging myself professionally or to contribute to my own development, a move even to another country with another set of unique experiences, or even a lateral move within United States to a position with a new set of challenges and a new set of demands will inevitably contribute to my development, to anyone's development. It's essentially icing on the cake that it so happens to be that we are doing this in Armenia. We are doing this for a nation and a people for which we have so much love for and for which we are so indebted to. There is so much of myself, of my family's identity that I attribute to me being Armenian and Armenianness, that having this stage of our life be in Armenia, having this challenge be within Armenia or Armenia's healthcare system is only, again, the added benefits of being here.
Okay, very good. Let's then talk a bit about Armenia and specifically healthcare, your area of expertise. You mentioned multiple challenges we are facing in Armenia, specifically in healthcare. Again, without going into all the details, high level, if you would say those are the 3 or 4 key issues or challenges in Armenian healthcare, what are the specific things you are having in your mind?
Now here we get into questions that are a little bit more challenging to answer, because healthcare, as you can imagine, is an extremely complex system, and it would be very hard to identify, say, 1 or 2 things that if we can fix, we would imagine a system that was completely different. However, there are indeed certain aspects and components to any healthcare system which are priority and are the fundamental pillars of any healthcare system. Financing and funding of the healthcare system is, of course, a huge one. Dealing with the legacy, in our case, of the Soviet healthcare system, where care tended to be highly fragmented and there was a dependence on specialists. The creation and the availability of our workforce is yet another complex challenge that we need to find solutions to. And ultimately achieving equitable, universal, comprehensive healthcare that shifts the focus of healthcare to truly making sure that patients and our population remains healthy, rather than focusing on treating illness or disease, is another area or a perspective that we need to keep in mind. I would finalize or summarize by saying the other perspective is that we oftentimes have a disbalance in Armenia, not specific to Armenia, but very much so in Armenia, between utilization or access to healthcare and quality of healthcare. We, as a whole, to include the diaspora, tend to focus our efforts on the provision of more healthcare and less discussions on and less attempts to find solutions or improve the quality of healthcare that is delivered in the country.
I know there are more hospitals in Yerevan than in, for instance, Los Angeles. Yeah.
Indeed, per capita.
Yeah. Per capita, absolutely. So, how do you see the situation in regions, in Marzes? There is certain disbalance, and again, based on your experience, what would be the solution here?
Yeah. Arman, in a lot of the global health literature, we hear this concept of a double burden of disease. In many countries that are emerging from poverty, we see both issues of undernutrition, for example, and now obesity as well. To draw a parallel to that in Armenia's healthcare system, we have this double burden of disease as well. We have in rural areas double burden of this condition as well. We have the issues of insufficient infrastructure, human resources, accessibility in rural areas of Armenia. And then we have the conditions that you have highlighted, which is a surplus of healthcare workers in Armenia, a surplus of hospitals, which again, one may think is an advantage if we believe in the saying the more the better. But in fact, unfortunately, healthcare doesn't work that way. Quality is very much dependent on certain centralization of care and certain number or quantity of volume so that we can assure various levels of quality. The solutions can be multiple. We can, of course, think of strategies so as to recalibrate and find solutions to both of these areas of maldistribution by reallocating some of our resources, by incentivizing doctors and nurses to work more in the rural regions. We can also directly go towards further contraction of healthcare facilities and infrastructure in Armenia. But there is also an opportunity to be a little innovative here as well, and to think about alternatives of what to do with the existing healthcare infrastructure in ways that aren't necessarily defined in traditional healthcare. Can we use the surplus of this infrastructure or healthcare workforce to maybe have more focus on healthy living, on prevention of disease, more so than other countries, even more developed countries? Can we somehow turn this into an advantage for us rather than purely think about it as a disadvantage? So we will need to come up with the various strategies so as to address this concern that you've discussed.
We all know that in Armenia, we have very kind of a special situation in healthcare. Yeah? And for instance, just one number, 85% of all the expenses in healthcare actually are out of pocket. Now, you are coming here with your experience, with your knowledge in public health in countries like US. Yeah. So, and I'm sure you heard this type of comments. In Armenia, we have very special or unique situation. You cannot just bring this experience and make it workable here. So, if I would ask you, do you think there is a readiness to be open for the new approach in Armenia? Or you again, working with the government, with the clinical stakeholders, you see kind of an issue here, kind of, it's a mindset issue, it's not openness to new things which can really help or change the situation. What is your view here?
Well, I can certainly give my view, but I would also like to give objective data and objective evidence, and the data and the polls and the surveys have in fact shown that there is a lot of interest and enthusiasm in developing a system where we approach having universal health coverage, for example, even amongst surveys that have been done amongst the population. And in terms of organizations, whether they be the government organizations or private or other not-for-profit organizations, gearing up or doing what is necessary on everyone's part so that we can achieve a state where the citizen of Armenia does not have the risk of having the catastrophic health expenditure that they do today. The evidence is beyond my opinion. It is all there. We have seen that in the priority, for example, of the government strategy is the ultimate achievement of universal health coverage. We have seen that there is buy-in amongst the hospitals and the not-for-profit sector so that we can attain this very, very ambitious goal, but a goal that is very necessary. And I would say, I would agree that my personal experience, having been born and raised in the United States, should not necessarily be the one that we use as a basis for developing this roadmap to achieve what we all want, to make sure that every Armenian gets healthcare regardless of their where they are geographically or financially. In fact, there are many other countries in the world that can serve as a much better precedent for the roadmap that we, Armenia, should adopt. I would say in the 2 years that I spent in Canada, I learned much more about how to achieve that vision than I have in the decades that I have been involved in the United States. So to sum up, yes, both subjectively in terms of my opinion, as well as objectively in terms of the actual work being done and the actual results of data of surveys and polls, we are in line, and there is interest and there is willingness and buy-in to undergo and to embark on the sometimes painful reforms and the changes that we will need to undergo, but that we all recognize are necessary so that we can achieve the health system that all Armenians deserve.
Okay, so let's switch the topic a little bit, yes? So diaspora and Armenia. I know you have been involved and you spent a lot of time here in Armenia even before you moved here with your family, yeah? So now if you think about the connection and relationships between Armenia and diaspora, do you think the war in 2020 changed the equilibrium in some way or another? I heard a lot of kind of comments from different people, again, from diaspora, from Armenia, that in the past there was kind of a, let's call it, social contract when diaspora was involved in one way or another, either by donating some money or coming here and spending some time here in Armenia. Everybody was happy, but something changed after the war. So, and for you specifically, you moved here with your family. In your opinion, what was that trigger that probably changed this paradigm and actually changed this equilibrium?
I think the answer is yes, something has changed. I don't know if that change is a large movement quite yet, but I think the seeds and the potential for there to be a large movement towards that change is absolutely there. And to me, at the risk of oversimplifying things, that change is exemplified by people who are willing to double down on efforts to develop and to improve Armenia's statehood, whether that is in our field, healthcare, to make sure that even if one day the diaspora or other investors or other partners are not around, that Armenia itself will be capable of having a good healthcare system, continuing on the path of reforms, continuing on the path of improvements. And this is the same for all other sectors, to include economy and defense and whatnot. To me, it's best exemplified by the transition or the understanding that we as the diaspora should transition from being primarily in the humanitarian partner mindset and evolving more towards being contributors to nation building, to institution building, and to strengthening the systems in Armenia, which will ultimately be the forever bearers of the responsibility of statehood for this country. And yes, after the war, particularly after being here and moving here, we do see this, I do see this on a daily basis, where people who really believe that the ultimate investment is in developing systems that will be able to sustain themselves in perpetuity in Armenia is the best investment that we in the diaspora can make. This is not at all to say that there is never a role for humanitarian assistance or there is a one-size-fits-all approach. But in general, this changing of the mindset to focusing on developing the internal capacity and the institutions of this country is an important one, I believe, and one that I firmly believe that we should espouse more as diasporans.
I think this is a great point, yeah, and this difference between humanitarian approach versus structured, systemic, institutional approach, I think is very important. Do you think there is, again, readiness from both sides? Or let me put it a different way. What should be done from both sides, Armenian and diaspora, to make this more kind of effective and more organized? Yeah, I can give you a very simple example. If you ask, do we have clear understanding what are the things diaspora is doing in Armenia? Do we have a list of all those initiatives, programs, projects? When I asked this question, actually I wasn't able to find an answer. So, and there are numerous examples like this, yeah, but what do you think we can do, each of us can do, to strengthen the connection between Armenia and diaspora, to really work together and make sure we can benefit and learn from each other?
Yeah. I think there are certain preconceived notions on both sides, as you mentioned, that we need to break. And for me, it's important to keep things in perspective. And what I mean by that is, if we as a diaspora are always complaining or stating or seeing as a barrier Armenia or Armenia's representatives as entities that do not allow us to contribute to our maximum, let us always remember that there are countries that put up far more resistance and barriers, that are far more corrupt, for example, that are far less resourced, for example, that have far worse or less developed institutions, but within which various entities, organizations, individuals have demonstrated remarkable successes. Some of the strides, again, coming back to our field of healthcare, of, for example, reducing maternal mortality rates in countries in sub-Saharan Africa that would be so much more difficult to work in than the conditions here in Armenia, were achieved. Whereas even with the resources of the diaspora, we have had much slower improvements in things such as maternal mortality rate and infant mortality rate. So the question on the diaspora side should be, even if the conditions are such that we think it is very hard to do quote unquote business in Armenia, how can we overcome these perceptions or these realities, if they are realities, because other people have done it in other places where it has been much more challenging. On the Armenia side, there are equally perceptions that need to be broken. The perception, the common perception, or what we often think is the perception that the diaspora is felt to be a financial cash cow, for example, or other perceptions of what we think or what Armenia thinks the resources of the diaspora can bring into the country should also be broken. Armenia should think about other ways of engaging the diaspora, of minimizing, for example, the financial engagement and maximizing other forms of engagement. And we are seeing this. We are seeing this through programs on the younger level, such as Birthright Armenia and others, and on the more professional level, like the EGORS program that we have been beneficiaries of within the Ministry of Health, and that has brought to bear a lot of fruits in terms of its effectiveness. And so I think step one is to break these perceptions, to understand that Armenia is not unique, that any diaspora Armenia or diaspora any other country relationship will have its real and perceived barriers, but we need to think of those not as reasons not to be involved, rather as part of the package of challenges we need to overcome on both sides, as you mentioned.
Yeah, and I think in today's truly connected world, there is no need to be always physically present to do something. Yeah, it can be commitment still to be involved, to dedicate some of your time, But I think to find this formula, which would allow people to really get involved and get engaged with Armenia, I think this is also kind of a personal question or challenge, and we all need to think how, in a most effective way, we can do that.
And perhaps an important enabler of that is increased dialogue, open, frank, transparent dialogue between Armenia and diaspora and representatives of Armenia and diaspora, because indeed, a lot of this may simply be perceptions, may simply be a lack of true understanding of what the abilities and the concerns of each side are. So for organizations or people who are able to facilitate such dialogue, I think there is a tremendous role for that will open up a huge potential set of opportunities that are right now remain locked in a cabinet, unfortunately.
Okay, so there is a famous statement saying to create the future, you have to invent it. Yeah. So let me finish by this conversation by asking you a question. What is the future you would like to see for Armenia? And probably you have also, you can start with healthcare, but in general for Armenia. So, and what we need to do, let's say, now and tomorrow to come to this, to realize this vision in whatever 10 years. And I understand it's a question you probably can spend another half an hour or 1 hour, but if you can summarize it, that would be great. Thank you.
I would say my vision for Armenia and Armenians is a place where every Armenian can replicate our experience, my experience, our experience as a family. A place that is perfectly suitable to give, to contribute, and to receive. For us, we have received more than what I think I can ever contribute, but we are at a steady state and we are at a point where we have a very comfortable relationship with being an Armenian and currently living in Armenia. And that give and take relationship doesn't at all have to be at the quote-unquote expense or investment of living in Armenia. One can very much achieve that state without physically being here in Armenia much of the time or moving here. But it's that relationship where we feel like we are contributing to, we are part of Team Armenia. We are contributing to the team that we believe in, and we want it to be victorious, the winning team, but we are also enjoying being part of the team. We are also receiving a lot of gratification, a lot of personal development from contributing to that team that will soon be the winning team and is on the path to being that winning team. And using that somewhat abstract model to bring it down to healthcare is very much the same, and it comes back to the original question that I have, that you asked and that I answered, which was, if my little experience is in healthcare and my ability to contribute in my little way is in healthcare, if I can do that and be personally satisfied and gratified and have some contribution, and if we can scale that up so that every Armenian can do that, then it's undoubtedly the case that the team will be the winning team, because we do in fact have incredible resources both here and abroad.
Very good. I think we can conclude here, and with this statement, winning team for Armenia and for Armenians. Yeah. So thank you, Shant. It was great to talk to you.
Thank you for this opportunity. It was a pleasure.